Opportunity brought husband and wife Ayman Chanuda and Samir Azab out from Egypt.
Hello, good morning. Good morning.
But Wagga Wagga, 5 hours southwest of Sydney, wasn't quite where they'd expected to settle.
No. It was hard in the beginning. Everyone was very supportive, and we bought house straight away, and we anchor, and it was a beautiful journey.
Soon after they arrived, the doctors diagnosed a problem.
This community really is struggling for having doctors to look after them.
It was their faith that helped them find a solution. As Coptic Christians, the church plays a central role in their lives, so they set about establishing a place of worship in Wagga. Since then, it's brought dozens of Egyptian-born doctors to the town, creating a community and a thriving GP practice.
We arrived in Wagga in about 2000 and we established the church in 2003. This church have attracted 47 doctors to the Riverina Murrumbidgee area, which is a great achievement that we never expected. But you can imagine there was a huge shortage of doctors in the Riverina Murrumbidgee, and this church has sorted out the shortage of doctors in this area.
Overseas trained doctors are the backbone of rural health, but recruiting them is a slow and costly process. A report handed to National Cabinet has called for urgent changes. For example, Australia's English language requirements are onerous, according to the report. Bringing them in line with the UK and New Zealand would help recruit an extra 2,750 doctors over 5 years. Lifting the age threshold for permanent skilled visas above 45 would bring an additional 4,500 GPs to Australia in that same period. When they arrive, the doctors have to spend up to 10 years in a regional area, and often there's little support, training and mentoring on offer.
I try to give them the security that they need to have to be able to achieve their goals. So they don't mind coming to a rural area, but they worry about being isolated, being left and neglected.
Marion Dover was also born in Cairo and moved to Sydney as a child before training as a rural generalist.
50% of our rural medical workforce is overseas trained doctors, but also the really important thing that we need to do is we need to attract our locally trained doctors.
She's a rarity. Only around 10% of locally trained doctors are choosing general practice. Even fewer are willing to move to the country.
I love my job, Jane. I tell people there is nothing I would rather do. You work in the emergency department, you deliver babies, you see children after, they come in with their mum and dad and you look after them after you've delivered them. And there is that continuity that's so powerful with someone's health outcomes.
Passionate about rural health, Marion Dover says for many, there's just not enough money in it. GPs are paid on a fee-for-service basis, but she says they should have the option of a salary.
We really need to fund and support general practice because the outcome of not having general practice is devastating.
In regional areas, people typically have to travel further distances, wait longer and have a smaller pool of doctors available when they need care. And the impact is profound. Statistics show those in more rural and remote areas are actually living shorter lives because medical conditions are going unnoticed or untreated.
Regardless what your postcode is, you deserve to have quality care. It's a bit disappointing really because there is solutions.
His community is fortunate he found one. Jane Norman, ABC News, Wagga Wagga.